Application of a clean dressing. If a wound needs assessment for the dressing change, the assessment and the dressing change must be done by a healthcare professional. This certification allows you to change a dressing using clean techniques, not sterile techniques. Sterile techniques require a healthcare professional to do the dressing change. You will follow simple steps for changing a clean dressing. It is very important to report to a healthcare professional promptly if the wound is not getting better or is getting worse. You notice drainage. You see increasing redness. The person complains of pain. The wound is getting bigger, not smaller. You see red or blue lines or streaks on the skin by the wound. The wound smells. In most cases, the dressing is used to protect the wound and to keep it clean. You may be applying a prescribed anti-infective medication to the wound. If you have first aid certification that taught you to put an over-the-counter anti-infective on minor abrasions and cuts, you may do that. Even if the wound has a scab on it, you need to wear gloves when cleaning the wound and applying a dressing. When removing a bandage, pull down on the skin in the opposite direction of the way you are pulling up on the bandage to minimize skin damage and discomfort. Steps. 1. Wash hands. 2. Gather supplies. 3. Put on gloves. 4. Identify the person and explain the procedure. 5. Assist the person into a comfortable position for the dressing change. 6. Remove the old dressing and discard in a disposable bag. 7. Take off dirty gloves, wash hands, put on clean gloves. 8. Cleanse the area with gentle soap and water, or as directed by a healthcare professional. 9. Open the package of the new dressing material without touching the clean part of the dressing that will touch the wound. Place the dressing clean side up on a clean surface. 10. Apply the medication to the pad of the dressing without touching the medication container to the dressing. 11. Place the dressing over the wound and secure it in place. 12. Discard waste supplies, remove gloves, and wash hands. 13. Return unused supplies to the storage area. 14. Document exactly what was done and how the person responded to the procedure. 15. Document and report the following observations to a healthcare professional. Odors. Change in amount or color of drainage. Pain in or around wound area. Increasing redness around the wound. Red or blue streaks. Other color changes. Remember, certified personnel are prohibited from using a debriding agent or packing or irrigating a wound. Hydrogen peroxide is not a recommended product for cleansing a wound, unless specifically ordered by a healthcare professional.